Assalamu alaikum. Welcome you all to this session today from Special Childcare. And this is me, Said Ahmed. I would like to welcome you all to this very important session today. And we have today, for the third time, we are very happy to announce that Dr. Christos Nikopoulos from London. Dr. Christos is a senior behavioral consultant. He's also the CEO of Autism Consultancy Services based in London. He's also working for Riyadh, on autism issues, and we are very happy to have him today. But we have a very special topic today because we have seen from his post that Dr. Christos is offering a kind of RBT training course for parents and caregivers and professionals. So we will talk about this today because many parents ask me about the details of the course, because you know that this is a very rare practice in Bangladesh. We have, but that's very expensive, and the parents they want to know basically the parents whose kids are growing up, and they are almost like around like 11-12 years. I think they are more in trouble with these issues, the behavioral issues. So parents want to know, some practitioners also want to know about this training program, and he is the right person. He's having a PhD in ABA, and he's a parents educator, and also he educating other professionals. And we are really very happy to have him and very lucky to have Dr. Christos Nikopoulos. Doctor, I would like to welcome you to our session today.
Thank you very much. Thank you very much for this warm presentation and for the offer to speak to the group. It has always been a pleasure for me. So I will try to get to the point. I will share my screen.
Sure.
Now, what is hold on. Yeah, here. What is the RBT? The RBT course. The RBT course stands for Registered Behavioral Technician. So this is the website of the BSCB, the Behavioral Certification Board. So everyone can get it. bscb.com is the link. So if you click here, it will take you to the RBT. What is the RBT? I recommend that I will, of course, give you a short presentation, a brief presentation, what the RBT is and what the course that I offer is. But here, there is the handbook. I will strongly advise anyone who is interested in that to click on this. Now, the RBT is for professionals. They get an accreditation from the BSCB, so they become professionals in order to provide treatment to not only to individuals with autism, but to provide applied behavioral analytic methods and procedures. This is the main purpose of the RBT. And here, if you see the requirements, is someone to be 18 years of age, to have at least high school diploma, then the background check, the criminal bureau, to complete the 40-hour training. This is what I am offering, and I will tell you more details in a minute. And then after that, there is the competency assessment. The competency assessment, which is based on this training. When someone has done all of this, then can apply, and then they need to sit and to pass the exam. The exams via the BSCB are online exams. Now, in order, when this happens and then they pass successfully the exams, they receive the RBT accreditation. In order to maintain this accreditation, because they cannot be shown as an active RBTs in the BSCB register if they do not receive ongoing supervision. This hands-on supervision that Said mentioned before. And this is for the 5% of the duties that they do during the week. Of course, to adhere to ethics and to renew annually their accreditation. They don't have to pass the exams again, but they have to pass the competency assessment. So this is the formal route that someone follows. Now, I would like to explain now this, that if someone completes the course, sit for the exams, gets the RBT, but this person has got difficulties to get a supervision from a BCBA or a BCABA, this does not mean that all this work up to here is lost. In the register, it will be seen as inactive, and whenever a supervisor is available and takes that person on board, they will be seen as active. What it means this, let me show you. If you go on the first page of the BSCB, which says find the certificate, click on that. This is where the register is. Now you will see here that you can click active and inactive. If we click, let's say, RBT only, and here you can input any country that you want. If I put, for example, UK, this is available to everyone, so everyone can search and use this search engine machine. So if you search, so here you will see the names of the people and where they are in the UK, for example. The last column says active, inactive. So if you click on that, that means that this person has got an RBT supervisor currently, now, at the moment, and they work. That person doesn't lose the coursework and all the work that they has done, but it says that it is either without supervisor or may not practice, and it says inactive. So when that person, for example, enters a program and there is a BCBA supervisor, then automatically it will become active because it will be shown that it works under the supervision of that person. Now this is the official, so you would see the active and inactive. So this is the official route. However, particularly for parents, it can be very, very helpful to be aware of the components, the tasks within the RBT, what exactly all the coursework is, for two main reasons. Even if they do not want to pursue any accreditation, or they are not interested in that, or it can be difficult because in Bangladesh, for example, there are not any BCBAs, or there are not many or anything. Why it can be important? Because first of all, they will learn the skills in order to help their children if this is possible, and then also they will be able to assess the people who work with their children, whether they have got the appropriate skills and to help their children. So in both ways, it can be quite useful, even if someone doesn't go ahead with all these assessment and the exams. So the coursework, the 40-hour coursework, so this is my web site. It provides here let me take this. Yes, it provides the course. So what is the RBT? As I said before, is a paraprofessional, a tutor, which is called typically called here in the UK, who always they need to work under the supervision of a BCBA or a BCABA. This is why I told you that why it is important. It is important because not only for someone to pursue a career, but also to be able to ensure that the higher standards of service are provided by assessing the people. Now, the the course, what are the tasks which need to be taught? These are provided by the BSB. It's not in our hands to choose what sort of tasks they are going to be provided. And there is a second edition task list. And the second edition task list is this one. You can find it in the handbook. If we go, so it covers the areas of measurement, assessment, skill acquisition, behavior reduction, documentation and reporting, and professional contact and scope of practice. So in my course, we go through all the topics. So for example, the measurement, prepare for data collection, implement continuous measurement procedures, implement discontinuous measurement procedures, implement permanent product recording procedures, enter data and update graphs, describe behavior and environment in observable and measurable terms. So this has to do with the measurement. The way that I am doing the teaching is as much interactive as possible. It is based on videos, it is based on PowerPoint presentations, it's based on multiple examples. Although RBTs can work in a number of areas, not only autism, because most of the people who attend are interested in autism, the examples that I give are presented cover the autism area. So many examples answering any sort of questions that may provide, they may come up from the participants in order to make it as relevant as possible to their own experience. Then the assessment, contact preference assessment, individualized assessment procedures, and functional assessment procedures. Then the main area, which is the skill acquisition, identify essential components of a written skill acquisition plan, prepare for the session for the required by the skill acquisition plan, use contingencies of reinforcement, discrete trial teaching procedures, naturalistic teaching procedures, task analysis, discrimination training, stimulus control, prompt and prompt fading, generalization, maintenance, shaping, and token economy procedures. For some of you, many of these words or terms here may be you may be unfamiliar. They may sound very jargon. In my course, there is always an effort to bring this to the level of the participants and gradually to explain and to introduce all these terms. So when a participant has finished, we know exactly what all these terms are about and how they are explored. Particularly for the acquisition, there are a number of exercises that the participants have to go through in order to learn as much as possible through practice all the components which are going to be provided to them. Then the next area is the behavioral reduction. Identify essential components of a written behavioral reduction plan. Describe common functions of behavior. Implement interventions. Differential reinforcement procedures, extinction procedures, and of course what to do in crisis emergency procedures according to protocol. So here, because in most cases you have to do the assessment, measurement, your plans, your programs, which the programs have to do either how to help a child or to help an individual to acquire specific skills, or how to decrease some inappropriate behaviors. So this is what it is, this area, the inappropriate behaviors. Then there is the documentation and reporting, how all this information may be reported and to collect objective data and so on. And for those who pursue, of course, the accreditation, the professional contact, the ethics, and the way of communication with stakeholders, how to maintain professional boundaries, and to maintain client dignity. So all of these things are covered, as I said, to give you an idea. Within these 40 hours, there are more than 40 video clips in which I present and I explain. There are about 800 slides. There are more than 35 handouts and further recommendations. And of course, when anyone who completes this, it doesn't mean that they are not going to see me again or anything. They can contact me at any time in order to provide continuous help and continuous support, even when the course has been concluded. So this training, the dates for this particular training are those. If you go to my website here, I can, I believe that I can send it to all of you in the chat. So it is. You will see the dates. The dates are those. Now, I know, and it had been discussed also in the past, that this course, the 40-hour course, this is the requirement from the BSCB. It cannot happen in less hours. But if there is a group of people that they want to learn or to cover as much as possible from this course, but without going for the accreditation, the entire course I have made it 28 hours. So it is shorter without covering mostly the documentation and the ethics. So it covers everything about the acquisition and the behavioral reduction. So it can happen in that way. And of course, if someone later decides to go for them for the accreditation, he or she will have the opportunity to top up these 12 hours, missing 12 hours. So the course starts nearly in less than 3 weeks, and it is mainly run during the at the weekends. So the times are here. Now the competency. So here the competency assessment that it happens. Hold on a minute. Let me show you this as the last thing. The competency assessment. It's a hands-on. So here it gives information how it's going to be, but the competency assessment, it can happen by anyone who is a BCA, BA, BCBA, and BCBAD as myself. It doesn't have to happen after the coursework. It can happen anytime after the coursework, after 1 month, 2 months. The only requirement is that when someone does the competency assessment, he or she has got 1 month until sits for the exams, from the BSB exams. And here the competency assessment is all the tasks, they have to happen with either a client or role play or even interview. Some of those should happen via role play, which means that, for example, how I conducted those, it can happen in multiple meetings. This person works with a client or a role play. They create videos. We go through the videos and then we assess whether these tasks were met, were addressed. There is not any possibility of failure. What it can be, for example, if let's say all the criteria have not been met for this one, for the preference assessments, then I provide constructive feedback and I say, okay, can you work on this? And then we will meet again whenever you are ready in order to see your improvement. So the competency assessment, mostly it can be seen as an opportunity for further learning rather than as an assessment. And finally, as a preparation for the exams, I provide all the entities the opportunity to sit for mock exams with me without any cost. I send mock exams to see how they will score, as if they were to sit for the BSB exams. They sent me back the answer sheet, and then based on this, I am able to identify the limitations or the areas in which they may need a little bit more work to do. And then I provide them with further resources and ways of how they are going to advance in the areas. So in that case, they will be more and more confident that they will pass the BSB exams. So, and these are the 15 is a 20 task list. If you take out the professionals, the requirements, and these are mostly about the ethics. So up to here, so this is the competency assessment. And I think that this includes, right, and that covers everything about the RBT. Now, is there any question from anyone?
Yeah, give me a minute, Doctor. I mean, have you finished your presentation?
Yes, yes.
Okay, just a minute, it's not working. Do you hear me?
Yes, I can hear you.
Well, yes, of course, we'll go for questions, but before that, can you allow me like 5 minutes time to make a kind of summary for what you ever said in Bangla, because in Bengali, some people are expecting and got a message in chat box requesting to make it Bengali. I'll not make, of course, the whole thing, just a few things. I mean, make a very short summary, okay? Please.
Yes, of course.
Okay, sure. So, যেটা হলো যে আমরা আজকে কথা বলছি ডক্টর ক্রিস্টোস নিকোপলাসের সাথে। উনি একজন কনসালটেন্ট, এবি এর কনসালটেন্ট, এবং উনি মূলত কাজ করেন হচ্ছে লন্ডনে। ওনার একটা প্রতিষ্ঠান আছে অটিজম কনসালটেন্সি সার্ভিসেস, এবং সেখানে উনি একজন সার্টিফাইড এবি এ কনসালটেন্ট, এবং ওনার পিএইচডিও আছে কনসালটেন্ট এবিএতে, এবং উনি বর্তমানে এছাড়াও উনি রিয়াদে কনসালটেন্ট হিসেবে কাজ করেন। আমরা এর আগে ওনার সাথে দুটো প্রোগ্রাম করেছি, কিন্তু আজকে যেটা নিয়ে কথা বলছি সেটা হচ্ছে যে উনি 40 ঘন্টার 40 আওয়ার্সের একটা আরবিটি ট্রেনিং কোর্স উনি অফার করছেন। সেটা এই ফেব্রুয়ারি মাসে শুরু হচ্ছে, এর আগেও তিনি করেছেন, এটা আর একটা ব্যাচ শুরু হতে যাচ্ছে। আরবিটি মানে হচ্ছে রেজিস্টার্ড বিহেভিয়ার টেকনিশিয়ান, যারা হচ্ছে এবি এর এক ধরনের অ্যাসিস্ট্যান্ট হিসেবে কাজ করেন। এবং এই আরবিটি ট্রেনিং করলে যেটা হবে যে বাচ্চাদের বিহেভিয়ার, শুধু বাচ্চাদের জন্য অবশ্য না, বা শুধু অটিজম বাচ্চাদের জন্য না, এটা সবার জন্যই বিহেভিয়ার মডিফিকেশনে কাজ করে। এবং তারা মূলত ডেটা কালেকশন সহ এবি এর যারা এবি এর মূল যারা কনসালটেন্ট তাদের অ্যাসিস্ট্যান্ট হিসেবে কাজ করে। এবং এটা করলে যেটা হবে সেটা হচ্ছে যে আমরা যদি স্পেসিফিক্যালি আমাদের কথা বলি, আমরা যারা অটিজম বাচ্চাদের বাবা মা, আমরা আমাদের বাচ্চাদের বিহেভিয়ার গুলো বুঝতে পারবো এবং সেই অনুযায়ী মডিফিকেশন করতে পারবো। এখন এখানে 40 ঘন্টার প্রথমে একটা কোর্স, এটা হচ্ছে ডক্টর ক্রিস্টোস উনি অফার করছেন, এটা অনলাইনে হবে। এবং হওয়ার পরে এটা যদি আর কেউ আর কিছু না করতে চায়, দ্যাটস ফাইন, সেটা শিখে গেল, তার বাচ্চার সাথে কাজ করলো। আর কেউ যদি এটার একজন কনসালটেন্ট হতে চায়, বা এটা একজন এটা যদি একজন প্রফেশনাল হতে চায়, তাহলে এদের যে সার্টিফিকেশন বডি আছে একটা বিএসসিবি, সেখানে পরীক্ষা দিতে হয়, সে পরীক্ষা দিয়ে পাশ করতে হয়। এবং সাথে সাথে একটা পার্টিকুলার সময় আছে, সেই সময় কোনো একজন এবিএ কনসালটেন্টের আন্ডারে তার সুপারভিশনে কাজ করতে হয়, কাজ করে পরীক্ষা দিতে হয়। আরো কিছু প্রসিজিয়ার আছে যদি সে একজন টেকনিশিয়ান হতে চায়, প্রফেশনালি সার্টিফিকেট নিতে চায়। আর সার্টিফিকেট যদি কেউ না নিতে চায়, তাহলে তো তার বাচ্চার সাথে কাজ করতে পারলো। তো এই হচ্ছে মোটামুটি ব্যাপারটা। এটা ফেব্রুয়ারি মাসে আরেকটা ব্যাচ শুরু হচ্ছে, যেটা নিয়ে আমরা মূলত কথা বলছি। এটা অনলাইনে হবে 40 ঘন্টা, টোটাল 7 দিনে। আমরা একটু প্রাইস নিয়ে কথা বলবো, ওটা আমরা দেখেছি একটা প্রাইস আছে ওখানে, কিন্তু ওনাকে জিজ্ঞেস করবো সেটা। তো তো এই হচ্ছে মোটামুটি ব্যাপার। এরপরে যদি কোনো প্রশ্ন থাকে তাহলে আপনারা প্রশ্ন করতে পারেন, আমরা ওনার কাছে যাচ্ছি। যদি কোনো প্রশ্ন থাকে, ও বাংলায় প্রশ্ন করতে চাইলেও করতে পারেন, আমি চেষ্টা করবো সেটা ইংলিশে ট্রান্সলেট করার। Dr. Christos, we want to come back to you, and you mentioned there the price for this course is said like 350 pounds. I mean, that is very
Yes. Yes, but there are discounts for groups for people that they will come in group. However, as I said before, if someone is not interested in getting the accreditation, without having anything from the quality of that course, but taking out all the let's say the specific requirements for someone to become an RBT, which are needed. So if we take this out, I can provide the course for 28 hours, and of course the price is much lower than that.
Mm-hmm. The people who will do it only for maybe for their children, not like trying. In that case, how would be the price?
The price, I had it. Can I give you when we finish? Because I had worked on this, but I cannot find it. All the itemization about both the prices for the less hours, and then all the discounts about the groups and how many people. I can give you this, let's say, when we finish within the first half an hour.
Of course, no problem. And then I can share with the group. Now, Dr. Christos, I mean, we are almost at the end, but just as you know that only a few parents joined today, but many more parents are interested, actually, even professionals. They sent me even a message. I mean, they want to know about it and requested for the video of this program. So, the point is just, I understood your point, but I want to just a few more questions, I mean, to make it like little more, I mean, clear for others, other parents. As I understood, this is, I mean, the 40-hour online, course, training course that you are going to offer, right? So the whole course, I mean, costs, I mean, altogether like $350, pound, I mean, British pound,
yes,
altogether. Yes. It will continue for 7 days, as I saw the, the schedule, the 7 days. Now, the point is, if somebody finish this course and leave, for example, he doesn't want to be a RBT technician. I mean, he use it for their kid, maybe for some reason. That's fine. That's not a problem. That is their business. Yes. Now, if anybody want to move on, right? They want to be certified, get certification. Then this is the first step, actually. This course is the first step. Other steps are, he needs to take a test with BSCB, and he needs to do some work. I mean, that is practice under the supervision of some certified, ABA consultant like you. So in that case, for example, that test, he will take the test before that hands-on experience or after the hands-on experience?
The test needs to be with hands-on experience. So not the experience, but all the tasks that I showed to you, the competency assessment, this is the first one. It can happen both with client, with a child, or with an individual, or as a role play. So this is the one which can happen with any BCBA or a BCA-BA. And it can happen through multiple contacts. When that finishes, then the person has to sit for the exams through the BSCB. So there is another exams. Now, that exams through the BSCB is the last one. The next year, when that person wants to renew, there will not be any exams via the BSCB, only the competency assessment.
Okay. Now, if anybody, after completing your course, if anybody wants to continue this, supervised practice with you,
yes,
is it possible online, or I need to go there to your center in London? I mean, which is not possible for many people.
No. It can happen. It can happen online, but it's not only me. I mean, with me, it has to do with the time. At the moment, my time availability is very restricted. However, there are people, and there are people also around Bangladesh or towards that area, and it might be, I haven't checked if there is any BCBA in Bangladesh who also will be able to speak your language, and this can be very beneficial. But most of this supervision, yes, can happen online, not only from me, but by a number of people by searching the BSCB register.
Yeah, I mean, they must be certified by BSAB. I mean, they
Yes.
must be BSAB certified.
Yes.
I mean, yeah.
Yes.
Okay, so
Yes.
okay, so that's all, I guess. The questions I have is very simple now, very easy now. I mean, your presentation was very easy. Is there any deadline to get registration for this upcoming batch?
The deadline, it starts on the 18th. So hold on, 18th is Friday. So if anyone who is interested until the 11th of February, so 1 week in advance, that will be quite helpful, at least for me to know and to do all the arrangements which are required.
That's really good. Okay, I'm just asking other people. I mean, আপনাদের কোনো প্রশ্ন আছে কারো? তাহলে আমরা প্রশ্ন করতে পারি। আমি বাংলায় কিছুটা এক্সপ্লেন করেছি। আপনারা বাংলাতেও আমাকে প্রশ্ন করতে পারেন। যার কোনো প্রশ্ন থাকে, জি। এখানে আপনার আইফোন নাম নাই কোনো। আপনি কোনো প্রশ্ন করতে চান? আপনি হাত তুলেছেন। জি, প্রশ্ন করেন, আনমিউট করে প্রশ্ন করেন। আমি ডক্টর ক্রিস্টোসকে প্রশ্নটা ট্রান্সলেট করে দিচ্ছি।
iPhone has raised the hand, but...
জি, প্রশ্ন করেন। যিনি আইফোন দিয়ে জয়েন করেছেন, আপনার নামটা লেখা নেই এখানে, এই জন্য এটা বলতে হচ্ছে। আনমিউট করেন, ফোনটা আপনার আনমিউট করে প্রশ্ন করেন। শুনতে পাচ্ছি না আমরা। কেন আনমিউট করতে পারছেন না? আমার এখানে কোনো ইয়ে নেই।
You can try as a host. Said, if you go to the icon where the blue, I think that if you click on that, you can unmute the person.
Yeah, I'm trying. So আচ্ছা, আর কেউ কোনো প্রশ্ন করবেন? আর কারো কোনো প্রশ্ন আছে? অন্য কেউ প্রশ্ন করতে চান? আমি ওনাকে ট্রাই করছি আনার জন্য, বা অন্য কারো কেউ প্রশ্ন করলে প্রশ্ন করতে পারেন। কারো কোনো প্রশ্ন আছে? আপনি প্রশ্ন লিখে দিবেন আমাকে চ্যাটে, কারণ আপনি এখানে টেকনিক্যালি কোনো প্রবলেম হচ্ছে সম্ভবত। আপনি চ্যাটে লিখে দিতে পারেন কোয়েশ্চেনটা।
Left.
Yeah, I was trying. I mean, is there some technical problem or what? I mean, you can try to, I mean, ask to write down the question in the chat box. Any other question? আর কেউ কোনো প্রশ্ন করবেন? He's joining. I hope he has a question because he.
Hello, sir.
Hello.
Can you hear me?
Yeah, it's clear. Please ask your question. Again, you muted yourself. Unmute and ask question, please.
Sir, I have a question.
Please. Don't touch that. Yeah, please. Again, you muted. I mean, yeah. Hello. Hello. He has some problem with phone, or I don't really get it. Hello. Oh, I'm sorry. I mean, we don't get. Could you please write down? If you want, you can write down the question in the chat. I can ask Dr. Christos for you.
Hello, Doctor.
Oh, again.
Some problem. One thing, Dr. Christos, I mean, a time difference is also another matter, another factor. So I hope that will not be a problem, because, you know, we have like, you know, 6 hour difference from London time, Dhaka time, but, you know, hope people can manage it. And still we have some time, and I'm sure I need to, you know, the parents will ask more questions, but if I have more, then I need to turn to you for the answers maybe. Because there are many people actually. I mean, in fact, today is a working day. That's why a reason only a few people joined today, and you know, the time is, so basically we have programs on the weekends. I mean, because we have Friday and Saturday off, so we try to arrange this, because parents most of the time stay home on these weekends. So, you know, hope we can go on, and we have almost like 17 days. As you said, 11th is the last deadline, so last registration day. So we have another 10 days. So hope, I mean, we can reach people, because there are many times, like they ask about ABA, we really need support. I mean, in this, and many parents, they want to learn themselves to work with kids.
Yeah, exactly. And I will send you also the information about in case that people don't want to do the 40 hours, we can arrange another time, more convenient times for Bangladesh.
That's good.
Yeah, and I will send you all the information about the pricing and everything. Yes, we can hear you.
Yeah, you have any question?
Yes, sir.
We have so many questions.
Okay, please.
Can you hear us, sir?
From the yes, please, brother, ask your question. We are waiting for your question, actually. And doctor also waiting for your question, because we have almost finished our session today. He's a very busy person. I'm sure you work all day, and almost like you're at the end of your day.
Yes.
Doctor, you're so beautiful.
From their language, I guess they joined from India. Okay.
Okay.
We're very happy to have them. I mean, from their language, I'm not sure, but because you have many parents actually. I mean, no, not sure. So no problem. I'll reach them. I'll reach them after the program, and I'll try to get back to you with their question. So if there is no more question, Dr. Christos, thank you very much for such a clear presentation. We may need to arrange more, maybe some mutual, like, you know, or I will call you maybe. So thanks for today.
Hi, my friend. Can you hear me?
Yeah, can you ask the question now?
Doctor, yes. Fuck you, Dr. Motherfucker.
I'm Queen Elizabeth from England.
Okay.
So I have a question for you, Mr. Said Ahmed.
Yes. Hello. Hello. No.
Okay.
Well, he has a question to me, I guess. So that we can solve later. I don't like to keep you waiting for that. So thank you so much, and we'll get back to you if there are any update, and you will share with me the other documents, especially for 28 hour data option. So I can share with them, share with my my fellow parents like me. Thank you very much. Wish you all the best.
Thank you very much
with your program. Hope it will be very helpful for us, because we are really confused with, I mean, the behavior of our kids, and as they grow up, you know, it becomes like more complex. So we need the support from you, like the professionals.
Yes, thank you very much for inviting me, and I hope that I will be of some help to any of you.
Of course. Thank you so much, and see you again. Okay.
Yes, of course.
Stay safe.
Thank you very much. Bye-bye then.
Bye-bye.